welcome everyone. It's our pleasure to see all of you out here on a Saturday morning joining us for what is going to be a 2-day festival. I am Natasha from Rohini Nilekani Philanthropies, and we have tried to put together a program to celebrate the mind, which is what Mannotsava is today. It's a festival of the mind, and when we were hoping to bring everybody into the room today, we thought, what is a better place to do it at other than NIMHANS, which is one of the excellent premier institutions in India. It's the national institution for this work, and it has had a deep legacy. We're also honored to be partners with NCBS that has worked together with us in putting this program together. So a little introduction about Mannotsava and what you can expect over the next 2 days. We wanted to have a public festival that would speak to topics of interest that are top of mind for people, conversations we have been having in our classrooms, in our boardrooms, in our homes, on the dining table. And when we thought of all of those topics, we said, who better to understand that from other than the community that we have? So today we have put together, today and tomorrow, we have a 2-day public program, which, as you all have registered, you would have probably seen the agenda as well. We have lots of talks, lots of parallel sessions happening where you can sit in on any of those conversations. We also have stalls outside that have been put up by faculty and teams at NIMHANS, as well as, again, many NGOs that are very active in the space of mental health. This is happening across 2 days. We have performances as well in the evening. One thing that you might have noticed about the program as you would have looked at the program is that when we think of mental health, it's not just mental disorders or mental illnesses, but it's mental health the way that health is integrated into our daily lives. And so we want to start and enrich this conversation on how do we think of mental well-being, how do we think of the full scale of human potential, how do we come together to dialogue as a community, to enrich ourselves, and to build connections to have a better sense of how we can all improve our individual and collective well-being together. So today we were expecting to have our chief guest, Mrs. Punya Salila Srivastava, who is the Secretary of the Ministry of Health and Family Welfare, but unfortunately she was not unable to join in person, so she has actually sent a little video as a welcome message to open this conference formally. And can I please request that video to be played?
Dear friends, I would like to congratulate NIMHANS, NCBS and RNP for organizing the National Mental Health Festival, Mannotsava. Under the visionary leadership of our Honorable Prime Minister, this government has taken several steps to strengthen and augment mental health care services. Mental health is as important as physical health and a very crucial component of our overall well-being and fitness. NIMHANS has always risen to the occasion. I still recall during the COVID-19 pandemic, they came forward with a framework for psychosocial support, not just for the patients, but also for the COVID-19 warriors. I wish all the stakeholders, all the participants, a very productive and successful Mannotsava, and I look forward to the outcomes from this festival. My best wishes. Together, I'm sure we can make a difference.
Thank you so much. So with that warm welcome, I would now like to request Rohini Nilekani, Chairperson Rohini Nilekani Philanthropies, to join us on the stage, formally welcome you all and share a few words.
Ellarigu namaskara. First, Natasha, on the suggestion of Dr. Pratima Murthy, can we play a surprise video, please?
Namaste. I'll soon be 100 years old. I try to be healthy again. All the best for Mannotsava.
That is Durga Nilekani at 99 not out, soon to celebrate her 100th birthday, my husband Nandan's mother, who really is an exemplar on how to be, as she says, healthy and happy. She says, I don't think about death, I only think about life. And we are going to celebrate her birthday, God willing, very soon. So Dr. Pratima said, you must make her the mascot of this festival. So that was Amma for you. ನಮಸ್ಕಾರ ಎಲ್ಲ ಮನೋತ್ಸವಕ್ಕೆ ಭಾಗವತರಿಗೆ ಹೃದಯಪೂರ್ವಕ ನಂದು ಸುಸ್ವಾಗತ. Good morning everybody. It is really my absolute pleasure to welcome you to the first National Mental Health Festival Mannotsava. A special and warm welcome and thanks to our chief guest, Punya Salila Srivastava, who could not come here but till last night was hoping to and was in touch with NIMHANS on this, but she got called into a meeting and gave us that warm message. Thank you, Ms. Srivastava. Thank you, Dr. Pratima Murthy, Director of NIMHANS, Professor L.S. Shashidhara from NCBS. It was not possible to do this festival without your collaboration. I also at the outset want to call out my team at RNP, which is led by Gautam John. And I really want to say they have worked so hard for so long to make this festival a joyous meeting between the practitioners of science and society. So I'm going to specially call out Natasha Joshi, whom you just saw, who helped to design and shape this and is in charge of my mental health portfolio, to Sahana Jose, who took on the heavy lifting of organizing all this, ably assisted by Shruti, and the whole team, in fact, at RNP. So just a little bit of applause. Our volunteers are everywhere, so please look out in case you need any help. Today, I somehow also want to remember my friend and IAS officer, Keshav Desiraju, who worked very hard to create one of the most progressive mental health policies in this country. So wherever you are, Keshav, you would have been happy to be here today. Over the next 2 days, we are going to explore mental health from many different angles, from inspiring keynotes, thought-provoking panels, hands-on workshops, to performances that move us. All this is awaiting the public of Bengaluru and visitors from around the country over the next 2 days. And we feel very privileged to have experts, of course, many of them, artists, community advocates, and the public in one room where we can bring issues of mental health into the open, try and absolutely drown out all the stigma around mental health, develop our own resilience and capacity for more well-being, and have new conversations that will reverberate across society. So, ಇದು ಆ್ಯಕ್ಚುಲಿ ಸಂವಾದ ಮತ್ತು ಅನುಭವದಿಂದ ಕಲಿಸಿಕೊಳ್ಳುವರ ಹೊಸ ಅವಕಾಶ. ಇದು ಒಂದು ಆರಂಭ ಅಂತ ನನ್ನ ಅನಿಸಿಕೆ, ನಮ್ಮ ಮನಸ್ಸಿನ ಆರೋಗ್ಯಕ್ಕೆ ಮತ್ತು ಸಮಾಜದ ಬಲವಂತಿಕೆ. So, just before the Festival of Light begins, before Deepavali begins, I feel this is a different way to celebrate the lightening up of our hearts and minds. Let's enjoy the festival, and once again, a very warm welcome to Mannotsava. Dhanyavada, namaskara.
Thank you, Rohini. Can I now request you to stay on stage, please? And can I also request Pratima Murthy, Dr. Pratima Murthy, Director NIMHANS, and Professor L.S. Shashidhara, who is the Center Director at NCBS, to come and light the lamp and please formally open this. So much for that. Now I would request Dr. Pratima Murthy to please address the gathering and share a little bit more about the work at NIMHANS.
ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. ಮನ ಮುಟ್ಟುವಂಥ ಮನೋತ್ಸವಕ್ಕೆ ಎಲ್ರಿಗೂ ಸುಸ್ವಾಗತ. I'll try and do it in Hindi as well. सबको आदरणीय सुस्वागत ये मनोत्सव के लिए. It's wonderful to have the first National Mental Health Utsav. And this is such a wonderful day today. It's sunny outside, the rains have abated. As Rohini mentioned, we're between Dasara, which is just over, and Diwali, which is coming up. So I think it's extremely important to celebrate our mental health and well-being, and of course, at the same time, continue conversations about mental disorders and what we can do for them. So Natasha asked me to give you a little bit of a background as to why it's very appropriate to have this Utsava at NIMHANS. So what I'm going to do in the course of the next few minutes is give you a glimpse. Yesterday, we had a very scientific discussion at the NCBS where we talked about the science of the Center for Brain and Mind, very, very generously supported by the Rohini Nilekani Philanthropies. And yesterday was really a lot of discussion on science. Today, I'm going to do a little bit of a 360-degree turnaround and talk to you about what NIMHANS has been doing, particularly in the area of community health. If you come and visit NIMHANS in February, March, this is the beautiful site of the Tababuya rosias. Now, many of you who've moved to Bangalore, probably, they call it the cherry blossom city, and there are Tababuya rosias everywhere. But about 19 years ago, this was the only compound which had these beautiful Tababuya rosias, and to date, it's a remarkable site every year. So NIMHANS is an institute par excellence. We celebrate 70 years as the first All India Institute of Mental Health, the first postgraduate mental health care center in the country. We're renowned as a center for excellence in mental health and neurosciences. We have a fantastic multidisciplinary team, and we have the tripartite mission of providing healthcare services, training, as well as carrying out research. And of course, we have top rankings and accreditations, which I'll just mention to you in a short while. So it was really very nice to have our health secretary, who has just taken over earlier this month, to greet us all. We'd have loved for her to be present in person, but the next best thing was to have the video greeting from her. So we evolved. Now, I must tell all of you that the first picture is a building which stands today at the Mysore Bank Circle on Kempegowda Road. This is now the headquarters of the State Bank of India, and earlier the headquarters of the State Bank of Mysore. That used to be the mental hospital in the 1850s on your left side. We moved to these premises in the 1930s, the stone building that you would have crossed, only the ground floor initially, and then of course we have a first floor, which is the Department of Psychiatry. The first All India Institute of Postgraduate of Mental Health, which is the stone building on the other side of Hosur Road, and of course the Neuro Center, which has also celebrated its 50 years. So we began as the Bangalore Lunatic Asylum, then became the Mysore State Mental Hospital, the All India Institute, NIMHANS in 1974, a deemed university in 94, and in 2012, by an act of parliament, we are now an institute of national importance. Our vision and mission is to be a world leader in mental health and neurosciences and evolve state-of-the-art approaches to patient care through translation research, capacity building, as well as policy planning, health literacy, human rights, and so on. We also have a very holistic and integrative approach to mental health, as witnessed by the fact that we have a center for yoga and Ayurveda, the Department of Integrative Medicine as well. So patient care, we're one of the largest healthcare providers in this space. We see almost 6 lakh patients every year. We have more than 1,000 beds for inpatient care. We have the round-the-clock emergency services, and to date, patients sometimes come from 200, 300 kilometers for emergency care as well as routine care. And of course, we have a diverse range of diagnostic and laboratory services. And we have a new subspecialty block of 125 beds for neurology and neurosurgery. We have 10 functioning OTs presently with state-of-the-art MRI. We have the next generation patient monitoring systems, over 2 million laboratory tests every year. We are the first NABH accredited institution among government institutions in the country. And this accreditation has now been successfully renewed as well. So we have more than 100 courses, in fact, 115 courses that we run, mostly postgraduate courses. We deal with healthcare providers and policy influencers and develop capacity for them. We train both medical as well as paramedical professionals in a variety of courses. And through the NIMHANS Digital Academy, we also have a lot of online courses which we offer. Research and innovation, we have a fantastic brain bank, which I'm sure many of you would have visited. If you haven't, do take some time to visit the brain bank. We have several collaborations with over 20 international organizations. We publish about 1,000 research papers every year, as evidenced last year. These are all our national collaborators. Of course, in addition to academic institutions, we also collaborate with NGOs and now with RNP. So it's very exciting that we collaborate with both government as well as non-governmental organizations. And of course, even at the international level, we have several organizations that we collaborate with. We also contribute to national policies and programs, particularly the National Mental Health Program, rights-based mental health care, disability, disaster management, addiction and tobacco cessation, the National Tele-Mental Health Program, the NIMHANS, where you can just call 14416 and get some help, whichever state or union territory you are. We've also forayed into climate change and mental health and so on. We've recently been awarded the Nelson Mandela Prize from the WHO Geneva for health promotion. And this really is the transition from a tertiary specialized care institution into going into the community, which I really want to talk about. Right from the inception of the district mental health program, we've constantly been engaging with the community. We've also been ranked the 4th rating in the national framework rating. We are 4th because we only offer postgraduate training. Unlike all the other medical colleges and institutions, the AIIMS, for example, they have undergraduate training. We have mostly postgraduate training. We've got the FICCI Award for Excellence, higher education rankings, 2nd prize in the Kayakalp, and of course, periodically we get rated as one of the world's best hospitals by Newsweek. Now I'm just going to talk to you in the last few minutes on our community outreach, because that is what is very relevant to Mannotsava here, and that's where we've possibly partnered with several of you to promote wellness as well as cultivate resilience, something that Rohini referred to as the spirit of this weekend's Mannotsava. So we have a community, in addition to our central campus that you see at NIMHANS, we have a community center at Sakalvara where we already have been rehabilitating our chronic mentally ill patients. This has also served as a training program for the district mental health program, which started off in Mandya way back in the 1970s. And here, in addition to providing training, we also have a multidisciplinary team which provides care for these patients. We hope to be able to start a dementia training center here, both for families to take care of persons with dementia and to also have a set of professionally trained people who can help to deliver dementia care in people's homes, because that's a huge need. It was such a lovely message from Mrs. Nilekani as she turns a centenarian, and we would like to celebrate our elderly, and therefore I think it's very important to have dignified services available for our elderly in all contexts. So this is about the Sakalvara Treatment Center. We also have community interventions offered by the Center for Addiction Medicine, collaborative clinical care centers in Turuvekere and Tirthalli. And of course, we have an urban center for well-being in the BTM layout, where people who don't like to come to NIMHANS or have milder interpersonal problems, family problems, problems with, for example, social media addiction and others, seek treatment in the BTM layout at Sakalvara, which you see here. Our digital outreach through the Telemanus, as I said, we've reached several lakh people in the last couple of years, and simply through a call, we are now able to offer several people, these kind of solace through our mental health Telemanus, and we connect up the Telemanus callers with all the services that are available in the community, so that if there is any acute suicidality, acute psychosis, etc., without any delay, these patients can be connected to mental health care professionals. This was inaugurated by the Honorable Health Minister, Shri J.P. Nadda, and since then, we now offer 34 accredited courses by our Board of Studies, including 7 diploma courses, as well as 27 certificate courses for a variety of conditions, so that people, including lay counselors, can get trained in offering basic mental health care services to everybody. So the whole idea is to really develop a complete repertoire of people who can help each other. And of course, recently we also, our Department of Clinical Psychology released a manual on self-care. So starting off with self-care for mental illness, to lay counselors, to more formal systems of training, we're trying to evolve a set of services so that people can find somewhere to go to if they need it. We have other kind of collaborations through philanthropy, the Goldman Sachs Mental Health Care Program Initiative, again, which looks at training different healthcare providers in different states across the country. We've trained a large number of nurses and trained more than 40,000 participants as part of this. Similarly, there are many other philanthropic initiatives which I don't really have time to talk about. Suicide prevention, all of us are aware of how big a global problem suicide is, particularly among young people. So suicide prevention through various programs. Recently, we launched a program called NSprite to look at ways of preventing suicide. The Suraksha project, which looks at training all the community healthcare staff in suicide prevention and being appropriate gatekeepers, promoting and empowering workplaces so that there can be suicide prevention programs in workplaces as well. There's something called the Ushas and the Yashas, especially in people who attempt suicide and who survive these attempts. It's very, very important to support them so that they recover from whatever was the underlying problem and do not reattempt suicide. And that has been an extremely successful program in collaboration with the government of Karnataka. In addition, providing support to carers and persons whose family members have died by suicide is also very important. We've also started a self-harm registry. And of course, this is a sharing stories of surviving suicide. Young people who for some reason, tried to take their lives and are very glad to have been, rescued, have all come together. And the whole idea is to energize and strengthen the community so that the need, the idea that even when all the doors seem closed, there is a window that's open for people is the message of hope that we need to convey to everybody. There are a lot of youth initiatives, including the Yuva Spandana, which has reached out to lakhs of youth to provide them, destigmatized healthcare services, for mental health care promotion, as well as to engage and empower youth to address their own issues so that they are able to have peer counselors who help each other. This is again in collaboration with the government of Karnataka. And recently, with the ICMR, we've started another project for campuses to be, schools and colleges to have suicide risk reduction programs, which is a multi-state implementation project supported by the ICMR. So you can see a lot of activities as far as that is concerned. This is an advanced center in digital interventions for mental health care. So especially for distressed, non-treatment seeking youth and older adults, the psychology department has developed something called Mind Notes, apps like PushD. The Addiction Center has developed an addiction treatment app for doctors and other healthcare professionals so that we can use technology to deliver. One of the more things that we look forward to is the use of AI, for example, and using its predictive value in perhaps predicting people who might be at risk for suicidality or detecting depression and so on. So using digital media in terms of improving our interventions is another thing that we look forward to do. We also have some other funded projects to empower communities through digital interventions. Let's Talk Life is an online, moderated peer support group for youth. And of course, many of these things are really about celebrating life, about developing resilience, and about being able to deal with the pressures of adolescence and grow up into mature, adults who are contented with their lives and contribute to society. So there is another CSR-funded project which we are looking to have sessions with campuses across 12 districts in Karnataka, again to promote self-help resources. And in terms of other positive psychology kind of interventions, again for suicide preventions, we work with NGOs, we work in different campuses, and we try to have what is called the Bridging Gap series, letters from youth to their parents and teachers to connect generations and reduce the gap or improve the connectivity. Again, the youth engagement, one more intervention that helps to break the barriers as far as young people reaching mental health services are concerned. So there are several other projects, Youth Pro, Feeling Good and Doing Well, mentoring for mental health, as well as looking at intergenerational well-being. I think Mr. Ratan Tata is a very, very good example of, of having initiated programs like this where younger people reach out to the older generation and therefore connect different generations across together. In terms of child and adolescence, there is something called SAMA, which looking at young people and developing school-based interventions in mental health. There is the Samvad, which looks at training all kinds of gatekeepers who are involved with children in requirement of child protection. And more than 3 million people have been reached through Samvad. Several people across the country have been trained in attending to the needs of children in conflict with the law. And of course, now in addition to the children, other empowering adolescents, reaching out to women, and looking at women's mental health is also a very important area of work. The Mental Health Sante just concluded last week, and we bring together organizations, and it's wonderful again that the Mental Health Sante, which was also held in October, is now culminating in this national festival of mental well-being, the Mannotsava. And this again has been a very successful program going on for the last 3 times. We also conduct campaigns in Bangalore's parks, have educational billboards, basically to reduce stigma and to improve dialogue in the area of mental health. So this is another program called Community Connect, which we are going to do in terms of going to the community and trying to bridge the gap between the professional knowledge and day-to-day knowledge. As we celebrate Manotsav, there is a NIMHANS walk which is happening right here to reduce the stigma around mental health. And this is the stories against stigma and the walks that we conduct at NIMHANS. In the last part, I just wanted to mention Naman. It's very interesting, Rohini, that practically everybody who was part of the initial Infosys is involved in one way or the other with NIMHANS. So, Naman is one of those projects where we are looking to reach rural communities through the Akshaya Hasta Trust. Women's mental health. Dr. Prabha has been a very great leader in women's mental health. We have programs like the Tele Swabiman to improve mental health care of pregnant women and postpartum mothers. We have a cohort of pregnant women into the postpartum. And Stri Manoraksha, which has been training people in one-stop centers, especially where women who face violence are looked at and treated. Then, of course, climate change, human rights, and other areas are also areas that we work in. Tele-yoga is also something that our Department of Integrative Medicine has started. So I just tried to give you a bird's eye view of what NIMHANS has done, not just in terms of providing a specialized tertiary care, which is still sought after by many people, but really trying to engage in the community. One of the questions I'm asked is, why does a specialized institute engage in community, community intervention? Unless we develop proper human resources in the community, we simply cannot cater to everybody. Everybody does not need to come to specialized healthcare institutions like NIMHANS. And therefore, having a good community network which looks at positive mental health as well as early detection of distress, amelioration of distress, and indeed the treatment of severe mental disorders which are as real as any physical disorder. Physical disorders and mental disorders have a bidirectional relationship. Both of them have to be looked at for holistic health and well-being. So what we have in the next 2 days is really both a celebration of the mana, or the mind, as well as a recognition that there is neurodiversity, there is diversity in terms of mental health care needs, that all of us need to look at each other, look out for each other with compassion, with help, and without stigma. All the best to the festival, and thank you, Rohini, for bringing us all together. Thank you very much.
Thank you so very much for your remarks, Dr. Murthy. I would now request Professor Shashidhara to come up and share a little bit about NCBS, please. Please welcome him with a round of applause.
There is a special, this NIMHANS is a special place. If you want to understand, ನಿಮ್ಮ ಮನಸ್ಸು ನೀವು ಅರ್ಥ ಮಾಡ್ಕೋಬೇಕಾದ್ರೆ NIMHANSಗೆ ಬರಬೇಕು. NIMHANSಲ್ಲಿ ನಿಮ್ಮ ಮನಸ್ಸು ಅದು ಒಳಗಡೆ ಸೇರಿಕೊಂಡಿದೆ ಅಲ್ವಾ? NIMHANS in English, of course, acronym, but ಅದು ಇಟ್ಸ್ ಆಲ್ ಅಬೌಟ್ ನಿಮ್ಮ ಮನಸ್ಸು. ನಮ್ಮ ಮನಸ್ಸು ನಿಮ್ಮ ಮನಸ್ಸು ಅಂತ ಹೇಳ್ತೀವಿ ಎಷ್ಟೋ ಸಲ, but it's all about understanding your mind, not my mind. There is the reason, there is a scientific reason for this, because there is a paradox. It's very difficult to understand your mind yourself. You need to engage with other people. You need to engage with people who have the experience, expertise, and who have the, the knowledge about how the brain functions. The reason is, we as any other plant or animal on this earth, a product of evolution. And it is a 3.75 billion year of history of life on earth. In that 374 crore years of history, we have just come on Earth for the last 200,000 years, the modern Homo sapiens. Of course, very different species of humans evolved over the last 5 million years, separated from a common ancestor between humans and chimpanzees. Every part of our body is a product of evolution. You can see commonality between every eukaryotic cell and human cell. You can see the neuron of a worm, neuron of a fly, neuron of a fish or a mouse or a human. They do not, if you are not an expert, you cannot really differentiate under a microscope. It's all the same. But as very different features evolve, certain emergent properties are species specific. So one of the emergent properties we have in our brain, where brain does many things which you are not even aware of. For example, every time you breathe, there are certain kinds of breathing patterns that are emerging that is again controlled by your brain, right? When you speak, you need to breathe differently. When you run, you have to breathe differently, right? When you're anxious, when you're eating, you breathe differently. All of these are controlled by brain, but that's not part of your awareness. You are aware of the brain in which you can talk about it. That's what awareness is all about. When you talk about your own brain, invariably you are actually talking with some amount of ignorance. Whereas other people will be able to understand better, but again, not everybody will be able to understand better. You need experts and people with certain experience and scientific thinking. The reason I'm emphasizing this is we evolved with limited cognitive abilities. We can see, for example, certain distance. Beyond certain distance, we can't make out. For example, if we see the star, all the stars are in the same distance from our eyes. But although there are several hundreds of light years apart, each of those stars. Similarly, we cannot resolve anything which is less than a millimeter properly. We need a microscope. We cannot see a virus, you cannot see a bacteria, although we know that they exist and they cause both diseases, or sometimes they are very helpful, particularly certain bacteria, right? And we also cannot see certain kinds of wavelength in the light. For example, we don't have ultraviolet vision. Many insects have ultraviolet vision. And we cannot hear certain range of decibels. For example, ultrasonic waves we cannot hear, whereas bats can hear that, right? So we have certain limitations in which we understand our external world, right? And as well as we understand ourselves with that limitation. When we have so much of limitation in understanding the world itself, right? How do you then understand your own brain, or understand your neighbor's brain or your family member's brain, and how do you interact with them? Because social interaction depends on how you understand each other. And science has provided ways to do this. Science is the way to understand both natural world and human world and about ourselves beyond our own perception. Again, it's a conflict, it's a paradox, it's a scientific, what you call logical conflict and a paradox. But it happens because that's what science has proved. 7 billion people on Earth even today have not seen Earth moving around the sun. But science has proved that the Earth moves around the sun and it's not the other way around, right? Every day we see sun coming from the east and setting in the west. So scientific methods are the only way we can understand the real world. The real world is not something which we perceive every day. Part of it is true, much part of it is not true, right? And because of this, we need people who understand the scientific methods to help you to understand your brain, our brain, all of us. Even as a scientist, I need other scientists' help to understand my own brain, right? How I speak, how I'm understood by others. You will be able to tell me about what's happening in my thinking pattern. Because I myself may not be able to tell this, irrespective of how good I am as a speaker, right? So given all of these things, it's important that we collaborate. We collaborate people from different background, different expertise, different parts of the society to understand the mind and any discrepancies that we think it is not normal. It is not normal is also again relative, it's subjective, right? And because we don't understand, we consider it as not normal many times, right? And most of the societal conflicts also because we assume that there's a certain pattern in life, and if people don't follow that pattern, that means they are not normal. It's not true. Everybody is different. there are very different kinds of differences. There are certain differences we can see with our eyes, morphological differences, height, color, variety of these things in the body. And there are certain other differences. People have different kinds of sensitivity to infection. Some are good in immunity, some are not so good. Some are good in metabolism, some are not so good. These are all variations that happens. Some are acquired during our lifetime. Some are genetically manifested. So one, we need to understand for all of these things, and in that, the most complex phenomena that we need to understand is our own mind, right? And we need collaborative effort. And one important factor here is the public understanding of science and the science of mind or brain. And for this, it's not enough scientists talk about it. We need other people. Karnataka has one of the, if you look at the literature of India in all languages, Kannada literature is very, very rich in communicating science in local language. And in 50 years ago, I'm sure many of you have read the novels of Trivedi, a famous Kannada writer. She has in few of her novels very scientifically explained the concept of very different behavioral phenomena and how people perceive what is normal and what is not normal, and how to really understand someone else's mind. Second is a famous medical doctor, Dr. R. Shivaram. We used to call him, his pen name is Rashi. And Rashi has written many, many short stories, fantastic short stories, about real characters who had some very different, so-called mental illnesses, but many of them are not mental illnesses. It's actually misconception of someone else predicting that it, or sort of thinking that it is some kind of an illness, right? So it's very important that we need to understand this. Of course, there are illnesses. There are medically diagnosed illnesses. I think that's the purpose why this kind of hospital is set up. But at the same time, a large part of mind, and when we ascribe certain non-standard behavior, it is actually a wrong perception by others, rather than it's actually something wrong with someone's mind or someone's the emergent properties of the brain. So I'm happy to be here with all of you on behalf of National Center for Biological Sciences. It is a research institution right here in Bengaluru, set up by Department of Atomic Energy as part of TIFR, Tata Institute of Fundamental Research, set up by Homi Bhabha long ago. And NCBS, since its inception 35 years ago, has dedicated to fundamental sciences, particularly in the area of life sciences. And one major focus, two major areas in which we focus. Of course, we work across all aspects of biology, but there are certain core areas. One of them is neuroscience, trying to understand the fundamental aspects of functioning of the brain. Second is biodiversity and conservation and environment related work, particularly wildlife biology. And over the years, we have collaborated extensively with NIMHANS, and to understand, genetically inherited or where medically determined psychiatric disorders. And in that context, last year, thanks to Rohini Nilekani for your fantastic philanthropic support, we have established a center called Center for Brain and Mind. And again, it's collaborating with NIMHANS, and we are following up a large cohort and trying to understand the genetic basis of psychiatric disorders and trying to develop interventions, early diagnosis and early interventions, so that we can reduce the health burden, mental health burden in the community. And I'm not, because I'm standing here at, in the NIMHANS auditorium, this is the place which is unique for the whole world. It's not about India's best place, it is the world's best place. It's the largest hospital and the research center in the area of mental health and neuroscience. And the doctors here, the clinicians and the scientists here are reputed all over the world. And again, congratulations for Nelson Mandela Award this year. And it's a privilege to be associated with NIMHANS and collaborating with all of you. And again, my last point here is, when you understand mind, when you celebrate mind, please don't think that we are only dealing with, so-called mental health. Mental health is again what you perceive as health, right? So if you consider as, there is a diversity in mind also as an emergent property of diversity of the brain, because within the brain also there are structural diversities, the way we have diversities in our own, what you can see from outside in our body. And each one of us are different. And one particular feature of brain compared to other parts of our body like lung or heart is it continuously improvises itself. The network itself, there's a lot of rewiring happens during very different stages of our growth. And because we live in very different context in our society, we live as a member of, let's say, son or a daughter of a family, or relative or husband and wife, and then as a professionally in some place. As this large society like in Bangalore, we may be simply a small dot in a traffic jam. So each place we acquire very different features, we respond to those features differently. So there's so much of diversity in how we behave, and there's so much different ways we behave in different contexts, right? Let's try to understand this, the science behind this, and 90% of our problem gets solved. Thank you very much.
Thank you, Professor Shashidhara. So I know that everybody is really waiting to understand how we have thought about this integration between science and society. This is something that Dr. Murthy has talked about a lot when it comes to this particular festival. So I will only take 2 minutes to explain a little bit about the work that we at the Rohini Nilekani Philanthropy, we do, and how we approach this work, not just in mental health, but overall in the work that we do with society. So just click through. So we are a grant-making institution. We're based in Bangalore. And we, through our years of work and through support from Rohini, we have supported and partnered with over 150 organizations across India. And at this point in time, we're very happy to say that we have some of the other partners in every single state in India. The areas of work that we do look at are actually 5 main areas at the moment. And each of these has a great legacy of work, which I would encourage any one of you to come and approach the team at Rohini Nilekani Philanthropies that's here today, including myself, to learn more. But I won't expand on each of these areas individually. That said, we do look at active citizenship, which is the idea of creating a civically engaged Samaj. We look at access to justice, because we believe justice is foundational. We look at gender equity by including boys and men in the conversation, and that is our Layak portfolio. The mental health work is what you will witness today in terms of our desire to build better integrations between science and society, and of course the relationship we have through the Center for Brain and Mind with both these institutions. And finally, of course, one of our very old and key portfolios is on climate and environment, which is trying to look at adaptation and resilience building across geographies in India, but in particular in the Nilgiris. In mental health, we not only have this partnership with the 2 institutions for the Center for Brain and Mind, but we have also supported, we have started to support field-based organizations that are working directly to ameliorate conditions and to support communities that are in need. So we have some of the partners, some of you might even be in the room, so thank you for that. We do have other areas of work because we believe that societal issues are very integrated and intersectional. So we do look at supporting think tanks, we look at public health as an area, we look at arts and culture definitely. And of course, we try to build a stronger ecosystem for social work in India. So that is one of the things we do as a foundation. And that's why beyond grants, we don't just make grants and sort of just provide capital. We also try to strengthen the sector through various horizontals, as we call it. So we do convenings, we do research and reports, which you can also go to our website and look at the different initiatives that we've done in terms of bringing philanthropy and funders together to start putting more capital in places of high need and supporting areas that remain stuck in today's social context. So research, of course, underpins a lot of our work, and it also helps us play back the learnings that we have from all of the organizations that we support and work with. this is something that we love to do, which is bringing people together. And that's our attempt today with the festival as well, bringing different stakeholders together, diverse groups that can come and dialogue and learn from one another and build connections. And finally, of course, we also look at putting out material, putting out advocacy, and really doing communication so that we can build more awareness about the areas of our work and the partners that we support. This is a journey that we've had, as I'd mentioned, that we do lots of unrestricted capital so that organizations on the field can operate with great degrees of freedom and be very iterative. And of course, as we are going to do today, we also try to look at expertise in every field and bring it out and open it out to society. Last year, we had two big highlights in terms of the public space. We inaugurated the Science Gallery Bengaluru. How many of you have been to Science Gallery? Okay. So Science Gallery Bangalore is something that we are very proud to be associated with. And of course, we launched the Rohini Nilekani Center for Brain and Mind. So I will leave you with this one small quotation, which will share the way we approach our work. And with this, I want to sort of formally welcome all of you. And I want to give a very quick description of what you can expect in the next 7-8 hours that you're with us together. So today we have two different sessions. We have public talks which are in the agenda for all of you. Some of you have come to join us for the curated meetings for the philanthropy track, and those meetings will start at 11:15 in the boardroom, which is on the second floor if you go up. For those who are here for the talks and the panels and sessions, you can remain in this auditorium for the Prevention is Better Than Cure panel, which is going to talk about preventive and promotive mental health. And for those who are interested in understanding ADHD, that conversation is happening in Audi 2. Through the day, there is coffee and tea for purchase. There's food outside. You will see if you get hungry, you can get a snack. And there are lots of stalls outside. Do engage with that. But before we close, I thought that, we are talking about togetherness and connection. So if you could all just raise your hands and give a big clap for the two people sitting next to you. And just acknowledge the fact that we're all here on a weekend, and let's have a wonderful weekend together. For anything, please feel free to approach our team, and welcome once again to Mannotsava.
I'd just like to, on behalf of NIMHANS, acknowledge the presence of two great people who are sitting on either side of me, Rohini Nilekani and Shashidhara. I'm just going to ask them to accept a small token of appreciation from NIMHANS.